Hi, everyone. I am Siris Rivas-Verdejo, and this is Choosing a Different Future. Thanks so much for checking in with us today. We have a wonderful guest. Dr. Bradley Morris is joining us today, and I actually have had a lot of wonderful personal and professional experiences with Dr. Bradley Morris. Have been eager to talk with him and have him on our show for a while. I'd love to let you know that he's actually a chiropractor of a doctor of chiropractics, but he has so many other things under his tool belt. He started his doctorate and his degrees and work in St. Louis, Missouri, but he also is available online and in person in Hilton Head, South Carolina right now, which is where I met him. And he has so many different certifications, different specialties. Just to name a few, he has a certification as a gluten practitioner, as a kinesio taping physician. He has a lot of functional medicine tools that he practices, which I would love for him to talk about more, because every time I speak to it, he always does a way better job than I do on that. And he collaborates with other professionals and holistic practitioners, really introducing cutting edge interventions and modalities so that his patients and the people that he interacts with in his practice are seen as whole people. And he looks at their entire body, all of their systems, and how they interact so that he can help them have rejuvenation, health, and probably much more. I mean, that's what I've already experienced personally. So thank you so much, Dr. Bradley Morris, and welcome to our show.
Thank you so much, Siri. I just want to clarify one thing. It's a gluten-free practitioner, not a gluten practitioner. So we want to make sure that nobody's eating that nasty gluten.
There you go. There you go. Especially if their bodies aren't asking for it. So,
yeah.
Gosh, so many different things that are involved in your medical practice. How long have you been a chiropractor?
I've been a chiropractor for the last 20 years. I started doing functional medicine about 16 years ago. And I really was just doing it because I couldn't figure out what was wrong with one of my chiropractic patients.
Mm-hmm. So you went to, and you were like reaching out and you said, okay, I have all of these other information, this traditional information, and this isn't quite working. It's getting to a certain point, and you reached out and found out more about functional medicine. Could you let us know what functional medicine is?
Sure. So to back up a little bit, this girl was 13 years old and she had chronic migraines, and she had been to every doctor known to man all over the country, and no one could figure out what was wrong with her. They were putting her on this medicine and that medicine. They put her on birth control at 13. And her mother was actually a patient of mine. And she's like, what do you think? And I go, well, I said, if everybody has ruled everything out, it's probably a chiropractic condition, right? Because, I'd seen it so many times with people having a misalignment in their neck. Maybe it was from birth, maybe it was from trauma. And I was like, bring her to me. Let me check her out. Everybody else cleared everything. So it's probably something I'm going to be able to fix. And so I examined her, and she did have a straight neck, and I fixed it. And she was like, my neck's better, but I still got migraines. And I'm like, there's no way. And so I had, I didn't want to just come out and say it to the parents. I was like, there's got to be a reason, because she was missing tons of school. And so I kind of probed a little bit and found out that she was a straight A student. She didn't really like missing school, and I'm going, this doesn't fit the mold.
Yeah.
And that's what led me into neurology and functional medicine. I'm going, there's got to be something else going on here. And so her name was Carson, and this has been tons of years ago. And I finally just started digging in, going, okay, what's causing the problem? And to make a long story short, she was reacting to food, and it was partially hydrogenated oil. And this girl was a little skinny girl, right? And so she comes running in one day, and I'm 6'2", and she's about 5 foot nothing. And she runs up to me and says, "You're wrong." And I'm like, "Uh-oh." And I go, "Why?" She goes, "Because my headaches are back." And I go, "What'd you eat?" She goes, "I ate just like you told me." And by the way, 16 years later, that's the most common thing everybody says to me. I ate just like you told me. And so I was like, okay, what was it? And she's like, well, I had a salad, I had this, and I had that. I had Kentucky Fried Chicken. I'm like, wait a minute. I said, I've been frying chicken in bad oil for years. You can't eat that. I said, that's what you're reacting to is hydrogenated oil.
Mm.
So we got her off hydrogenated oil, and that was it. Well, 16 years later, I've studied this stuff so intensely to figure out why are we having all these chronic conditions and why people aren't getting well in America. We're not having these problems in any other country with chronic conditions. You got to remember, the United States of America, #1 in acute care, but not #1 in chronic care. So that's really what led me on this long journey, which I love, and it keeps changing every time I turn around.
So just to clarify, so how does the identification of what she was responding to correlate with this idea of functional medicine? Like, what did you do with her to find out that that was what was going on, and how does that connect with what functional medicine is?
So in functional medicine, we're not really looking at what is the symptom, right? So that's what we're all trained in. If I have a belly ache, what's going on with my belly? If I got pinky nail disease, and by the way, that is a Dr. Morris-ism. I explain this to my patients. I'm going, most of my patients come in and go, wait a minute, I got my pinky nail hurts. I'm like, well, wait a minute, you must have pinky nail disease. You probably take a pinky nail pill. That's traditional medicine. In functional medicine, we want to know is, okay, why does your pinky nail hurt? You know, is it the pinky nail? Is it the nerve? Is there something going on metabolically?
Mm-hmm.
And so in functional medicine, what we want to know the why or the cause.
Okay, so would it be accurate to say that you're actually looking for the core issue? Like, what is the core, be it systemic or physiological things that are creating the symptoms?
Yeah, absolutely. You know, why? So what we always want to know is why. And that's the beautiful thing is if you ask why, then if you figure out the why, then you can figure out the how to fix it. But most of the time we're just going, oh, well, this is hurt or this is broke. Let me just fix the hurt or the break.
Mm-hmm.
We're not going, why does it hurt or why does it break?
Yeah. And so getting into from the superficial into the in-depth analysis,
yeah, exactly.
and looking at that.
Let's get rid of the problem, or let's get rid of the cause, not the problem, I should say.
Yeah. I'm not sure if I've ever told you this. It's funny that you bring up that your path, and I didn't know this before this discussion, that your path into functional medicine was from this 13-year-old girl that had all these things going on in her life, very similar to me at that age, where I had dysmenorrhea, at least that's what they were calling it, and I had all of this chronic pain that was starting then. And what they did as well, just like her, is they threw birth control at it. They threw all this medication, and they didn't really look at what was going on in my body in totality to really look at the cause. So when I finally fast forward another couple years, it created this platform for a whole bunch of autoimmune difficulties, be it chronic pain, allergies, asthma. And I think that all the seeds of that were already there back when I was 11, 12, 13, but the doctors wouldn't listen. So when someone comes to you and they've had these multiple attempts at trying other interventions and it hasn't worked, what are some of the questions that you ask them or that you invite them to ask for themselves?
So one of the things I want to do is I never want to pigeonhole. And what I mean by pigeonhole is going, and I'll refer back to pinky nail disease, okay, which is not a thing, by the way, everybody.
Yeah,
it's not
let's be that clear.
Let me
Don't start Googling pinky nail disease.
Brad is
yes.
Brad. I use it because it's ridiculous that when we go to our healthcare professionals and we go, hey, I got this pain here, they go, oh, well, we'll take this pill. It's going to fix it, which is ridiculous. No one's really looking at the root cause of things. And so what I'm getting at is when my patients come to me, I go, I definitely want to listen so I can go, where do I need to go with this? Mm-hmm. I understand it. And at the same time, I don't care. Mm-hmm. And the reason I don't care is because those are just symptoms. I want to know the cause. And I don't mean that, as being not passionate, because I'm very passionate about the problem, but it's the cause. If we find the cause, then we find the fix. Right? And that's the thing. The fix is in the cause. You can't fix anything if you don't know the cause. If your car is leaking oil and you just keep putting oil in it, you're going to continue to put oil in it. And that's healthcare today. Is you have a leak and all you're doing is putting oil back in it. You're not really finding the source of the leak. And that's the problem I see. And really, that's our success. Is I go, okay, well, I got you. I understand you have a leak. I don't know where it is. I don't know what it is. It could be diabetes, fibromyalgia, thyroid, Hashimoto's, lupus. You name it, whatever you want. I don't care what you name it. But I want to know why. Why is it? Why is there a leak? And when you find that leak, then you fix that problem. And you change people's lives. It's crazy. And I don't understand why that's not healthcare.
So what are 1 or 2 questions that you initially ask a new patient that has that history that will help you get to the why, the cause?
Unfortunately, there's not 1 or 2.
Where do you start?
There's I usually start with a simple questionnaire. I have a question that's 2 pages. And I'm like, listen, this is a great instrument. It's going to cover lots of things. I'm not going to give you too much insight on what it means because I just want you to answer those questions honestly. But it's paper, so I just tell people, and they come to me with everything under the sun. I tell them, I'm like, you know what, just fill these 2 pieces of paper out and let me see it. And then once I see those answers, then I can give you a better idea. So it's not 1 or 2 questions. It's a ton. And unfortunately, some of those questions will be repeated and they think he's trying to trick me. I'm really not. It's the organ systems may relate to more than one problem. So you'll see a lot of problems that have the same symptoms.
Could you give me an example of that?
Sure. So people that have leaky gut will have gluten intolerance. They'll have a colon problem. They have a stomach problem. They have a thyroid problem. They have a brain problem. So, one question may be, do you get brain fog? Do you have unclear thinking? That could lead to so many different problems, right?
Including like metal toxicity and things like that. Yeah.
Totally. And so, people that can't remember why they walked into a room. Is it the gut? Is it the colon? Is it the thyroid? What's going on there? Especially if they're autoimmune. So yeah, you can't pigeonhole any of this stuff. I would love it to be cookie cutter. My job would be so easy if it was cookie cutter. Oh my gosh. And what I do is I go, all right, how do we look at this? Let's look at this objectively. They got this, and they got all these symptoms, this huge array of symptoms. Their life is horrible. They have depression, anger, anxiety, whatever it may be. And I look at it and go, oh, you have blood sugar dysregulation. Let me level out your blood sugar. Let me figure out why it's dysregulated. You're going to get your life back. And all these other things can go away. In traditional medicine, what we do is we treat the brain fog. We treat the sugar. We treat the thyroid, right?
And each of them were the different medication.
Right. And all the side effects that go along with each one of those medications. But if you just went back and go, wait a minute, this guy's got a gut that's messed up. His stomach's not breaking down food, so he's not absorbing nutrients, and it's causing all these. So why don't we just break down the food and get him to absorb nutrients and find out why that breakdown went? Well, we just fixed an array of diagnosis. So do they really have all that stuff? No, they don't. I don't think so. What they really have is a breakdown at the stomach and the gut, which, by the way, is probably the biggest epidemic in this country. And it's because the food's terrible. Our food,
the quality of the food,
even organic and good food, is not as good as it could be. So.
And so, just to pivot a moment, so you're doing this all the time. You're full-time working with patients. You also have a family. And how does this play out, your awareness of functional medicine, of looking at whole life, whole person? How does that play out with your own personal life?
Well, I have three children who are 16, 18, 20. I was about to say I got 3 teenagers, but I forgot one transitioned. there's still 3 kids, right? My oldest is 20, and she is definitely the most sensitive to food. The 2 boys are probably the least, meaning, and what I mean by that is, of course, they're made up of my wife and I. The oldest is me, the middle is Barb, my wife, and the youngest is a mixture. So I always tell my wife, I'm like, take out lots of life insurance because my genes aren't nearly as good as yours. She's like, I go, I read blood work and epigenetics. And she's like, really? And her dad, God rest his soul, he passed away at 87. He could eat and do anything he wanted, and he was bone rail thin. My side of the family, I can't eat anything I want. I'm 6'2", 229 pounds. I was 230 for a long time, by the way. And so I dropped a pound. But we react to food. My genes don't like this genetic modification of food. And so with my children, it's a challenge because they're young. And when you're young, you're resilient. So you respond really well to any immunological responses. Unfortunately, the quality of things that are going on in our world are diminishing as we get older. I'm quite a bit older than you. You're quite a bit older than Abby. And the difference between what we've encountered in our lifetimes is really affecting how our bodies react. It's actually sad. In Europe, we don't have this. And the reason we don't have it is because there's no genetic modification of food. The FDA is not involved. And I hope the FDA did not hear that because I don't want them knocking on my door. I'm afraid of them because they're more powerful than anything in this world, or this country, I should say, not the world, because they're not allowed in Europe. But unfortunately, they are allowing things in our food that is ridiculous. And then, for example, my patients will travel to Europe, and I have them on gluten-free, dairy-free, soy-free diets. And when they go to Europe, I'm like, eat up. And they're like, well, no, I feel great now. And I go, well, when you go over there, you don't have anything to worry about. And they're like, how's that? And I go, because there's no genetic modification or Monsanto. There's no glyphosate on food. And they go over there and eat fine.
So they could have things that have gluten there. It's not really the gluten. It's just a type of gluten that we have here.
Exactly. And for a good instance, and some people can't handle either way. So don't make that a blanket statement. My daughter and I, we can eat Amish or European wheat, but we cannot eat American wheat. Otherwise, we have a GI upset, and it could be indigestion, diarrhea, constipation. Doesn't matter. It's a ridiculous problem to have here in America, being one of the greatest countries in the world, but it's epidemic. And people don't really understand it. And the thing is, it's a slow death. It's not one of those things that are, you eat it and you have a reaction. A lot of people think of allergies, they eat a peanut and they're like, I'm gonna die. No, this is intolerant. It's not an allergy. If it was an allergy, you wouldn't do it. But when we have these sensitivities and these intolerances, that's when it's a problem.
Yeah, a lot of people will ignore that and let it build until it becomes an allergy or becomes something bigger and a nail over your head, and then a hammer over your head, and then and then they'll actually address it already a lot later than they could have already addressed it earlier on.
Yeah. The worst part about it is it happens so slowly that it becomes pathologic, and they call it diabetes or Hashimoto's or lupus or fibromyalgia, right? So it happens so slowly, and then you search out a reason why, and then there's a lab marker that's off, and so then you get diagnosed, and you think, oh, well, my mom had it, so that's why I got it. That's ridiculous. That is ludicrous. We only really inherit about 5 to 10% of the genes from our parents. No, don't get me wrong. We have all the genes from our parents, but the gene expression, it's only about 5 to 10%. So to me, it's absolutely ludicrous that we're living this life that we live here in America with these things going on. It's just ridiculous.
Well, and even what you were saying earlier and joking with your wife about how she should get a lot of life insurance and things like that. Like I know from what you're doing in your medical practice, I've gotten to see it personally and professionally, like working there and getting to know your patients and things like that, trying out some of these really cutting edge interventions that you're doing there, that there's a lot of people who have had their familial history says that they shouldn't be able to have the lives and the bodies and the health that they have now. And part of that is these interventions that you've been inviting them to try out. So are any of those actually addressing the cellular or like the genetic expression that you were just referring to?
Absolutely, absolutely. So that's my whole, that's how I fix things, right? I'm like, okay, so if we can express a gene, we can unexpress a gene, right?
Mm.
If we
Mm-hmm.
stop expressing it, listen, if I stop throwing matches on a fire, the fire will go out. True?
Mm-hmm. Mm-hmm.
Yeah. If you're building a house and on one end it's on fire, but you keep building and you never stop that fire, is your fire or is your house eventually going to burn down?
Yeah.
Yeah.
Mm-hmm.
So in my practice, what I do is I'm like, all right, what's causing the fire? So I go after whatever's causing it so I can stop the fire. And then I rebuild anything that the fire tore down. And that's kind of how I explain it to patients. You
Mm-hmm.
know, I mean, because they don't get the scientific wording behind. All right, listen, there's this humongous breakdown in all these metabolic pathways that we got to repair. They get the fire in the house. House is
Mm-hmm.
on fire. You don't put it out, it's going to continue to burn.
Well,
Doesn't
and
matter.
that's what they're living. Because even me, who is in healthcare, sometimes when you're in the thick of it, when you're in that like almost crisis level, when you don't feel like yourself and what you know is possible with your body, you want to break it down simply. You want to get to what are your priorities in that moment and have relief as soon as possible. And so the complex medical jargon is absolutely not required
Totally
at
not.
all.
And nobody gets it. No one understands that complex medical jargon. So I try to just hit my patients between the eyes and go, hey, listen, if you want your life back, this is what we do. We're going to do it for a short period of time. I'm going to make you miserable for about 6 weeks. And after that, I'm going to start giving all these things back so we can go find your kryptonite. You know, Superman was a wonderful guy. He could do anything, right? Blast through walls, see through things, stronger than Nox, but he couldn't handle kryptonite. So I want to find out your kryptonite. My kryptonite happens to be gluten. I can't eat it, tears up my stomach, makes me not sleep. It's my kryptonite. But what's yours? You're different than me. You look different than me. But the cool thing is we're kind of all built the same. So when we figure that out, and then we figure out your kryptonite, you get your life back. And, you know, we all want to live. Let's be happy and have fun.
Yeah.
Why should we be suffering because, you know, you took a bite of a food that's totally killing something? I love that. I love AT&T sends me a phone call that says telemarketer. Why would they just block it? It makes no sense.
That's the next step. That's the next step.
It's like a telemarketer is calling you. Great. Now that you identified them, block them. So, I'm on my phone with you, you know.
Yeah.
So anyway.
I love what you just said. I think that's really beautiful. And I wish that more doctors addressed health and their patients in that way. I'm curious, for the viewers that are going to be listening to this later on and watching this later on, if you could give any tips for them to actually start with as they're looking in whatever level of health that they're at. They don't actually have to have a problem to go to your medical practice. That's the other thing that I love, that you don't actually have to have a diagnosis. You don't have to have the aches and pains. You don't have to feel like your body's all off balance for you to get a check-in, a consultation, and just even more information about their body. So wherever a person is in their health, what is something that you would recommend them to look at to make sure that their body is working optimally or they're living as optimally as they could?
So that's a great question. And I don't know if I can answer it because most people don't know what feeling good is, right? It's scary. They think they feel good until we change some stuff and they really feel good. So a really common statement that I get from a lot of my patients, they go, wow, I didn't even know what feeling good meant.
Mm-hmm.
It's scary. You know, and some of my patients are a little resistant. You know, I remember I'm a chiropractor, so they may just be coming in for a neck problem. And then they're talking to some of my other patients and go, well, you know, he did this and this. And they go, well, I didn't know he did that. And then they ask me and I change them. They go, you know, I didn't even know I felt bad until I started working with you. And now I feel amazing.
Mm-hmm.
And so that's what happens is we start not feeling good slowly. Now, what I mean is I want to get away from any diagnosed disease, right?
Mm-hmm.
I'm not applying this to anybody that got diagnosed. What I'm applying this to is, you know, I've been running on a treadmill, I've been eating right, I've been working out, and then I came and seen Dr. Morris, and he changed this and this, and I didn't even know what feeling good was.
Mm-hmm.
And that's one of the places that I started with. So one of my good friends at Powerhouse Gym, she owns a place, and I've done lots of talks for them. And you got people that are working out and eating right, and I look at them and they're not healthy, but they eat right and they work out. And they come on and they go, you know, I've been doing this. And I go, why don't you fill out that form? And that's the same. It's called a metabolic assessment form that I told you about. And I go, well, there's a lot of stuff not working right on you, and that's why you're not losing the weight that you'd like to lose. So a lot of people don't know what feeling good is.
Mm-hmm.
I mean, that's scary, right? They don't, because it happens so slow that they don't know what feeling good is. And I tell everybody, I go, listen, nothing tastes as good as feeling good. It only tastes good to right there. It tastes good right there. After that, it's screwing you up. But it was a wonderful taste. So if you, and this is not from me, this is from somebody I learned from. They're like, you know, listen, if you want a Snickers, chew it up and spit it out, because it's only good right there. And by the way, that's where your tongue ends.
Mm-hmm. Mm-hmm.
You know, and so think about it. It's pretty accurate. So, you know, to pigeonhole anything or give the best advice, it's so hard because we're all different. You know, we all look different on the outside, but we're all really not different on the inside to an extent. Epigenetics and nutrigenomics play a role there. My wife is a perfect example because she can handle almost anything, yet she's not feeling good today with a big smile. Because finally, she's been eating too much crap and it's breaking down. Maybe she got something, I don't know. But she's not here right now to hear that. So, and Siris, you can edit
Don't
that
get in trouble.
or not. You can edit that or not. It's all I'm good with either way. She usually feels pretty good, and she can handle just about anything because of her epigenetics and nutrigenomics. You know, so this is not a cookie cutter issue. It's
Yeah.
hey,
And it
what's
shouldn't
happening
be. Like,
with
it
you?
really needs
Just
to
like
be
me.
individualized.
Yeah, I took you and I put you on the table, and we did. I can talk about this, right? You can edit
Absolutely.
it out.
Go for it. Mm-hmm.
And I peeled back the onion on Siris, right? It's been
Mm-hmm.
different both times.
Yes.
And we are all different. Whoever lays down there on that particular modality, it's different every time.
And
So
you
that's
can
kind
feel free to mention the type of treatment we were. I mean, there's been a lot of different things that I've done at your practice. And that's one of the things I like is I like to actually speak to it from a place of my own personal, like I wouldn't recommend for anyone to go there or try it if I wasn't willing to do it myself. And to also receive the benefits of it. And it has been really beneficial. And it might not be that what worked for me and what my body was asking for is what is that person's body is going to ask for. But what's great about your practice and who, you know, you're working with Dr. Moshe Deckel, who's also been on our show, and how y'all complement, your skill sets complement each other. There's just so many different options there that whatever someone's looking for, it probably is a good place to start, at least is going to your practice. And I love that idea of that metabolic checklist. Like now I want to do it. I want to do that. Let's add that in.
Yeah, everybody should do it because it enlightens everyone going, holy crap, I didn't realize this. And the thing about it is, I will not give anybody any insights on it until after they do it.
Right.
The reason I don't want anybody to be influenced. I don't want their answers to be influenced. The only time that I ever veer from my method is usually with men, because we are all, yeah, I'm good. And so I'll have their wives filled out, and they're like, it's a completely different outfit. But it's one of those instruments that I've used for years, and it's been amazing.
Awesome.
It's been amazing. It's so close to blood chemistry. It's not funny. It's amazing. Yeah. And yeah, you can feel anytime you want, Siris. It's an instrument, and it takes me 30 seconds to read it, 3 to 5 minutes to explain it based on questions, but it's cool. Yeah, you'll dig it. I know a lot about you, and I promise you'll love it.
Oh yeah, you know me, I'm all about increasing my awareness about my life and body. So I'm signing up. I'm in. But yeah, thank you so much, Dr. Brad Morris, for being on our show. I know we can talk some more. I'm particularly piqued by what you just said about the difference between how you interact with your male and your female patients. We're gonna have a talk about that at some point. That's very, very intriguing to me. And all the implications of that potentially. And then you being a male doctor as well. So, but for right now, let's pause. Let's see what people have to ask and say about our discussion right now. I'm sure they'll have a lot of feedback. And for all of you that are watching, please feel free to post any questions to Dr. Bradley Morris below. He'll get in touch with you and go ahead and reply back. If you enjoyed our chat, go ahead and like our video, subscribe to our channel, share it with anyone you think would benefit from anything that we were talking about here. It seems like if you know of anyone who would like to have more awareness about their body or would like to go from feeling good to awesome and amazing, then definitely have them check this out and reach out to Dr. Bradley Morris, who's at Rejuvenate Health in Hilton Head, South Carolina. Thank you again. And was there anything else that you'd like to tell people before we part ways today?
Thank you for having me. It's been a pleasure, and I'll come back anytime. I'm happy to answer all questions. And like you said, I don't think people even know what feeling good is.
Yeah. What would feeling good?
I don't think they know until they've experienced it.
Mm-hmm.
Right?
And then it can still get better.
A lot of people go, I feel good. I'm like, are you sure?
Yeah.
What's better? How do you get any better than this?
Exactly. On that lovely note, thank you. And thank you everyone for watching. Bye.
Bye.